Welcome back to CEO Money. I'm Michael Yorba, your host, and I am talking right now with Scott Olson, CEO Pathway Healthcare. All right, Scott, welcome to the show. Thanks for being here.
Michael, thanks for having me. I appreciate it.
My pleasure. All right, you are saving lives one person at a time. Give us some background on you. I read it, but I'm going to let you expound upon it. It's a pretty nice background that you have, and then let's talk about Pathway Healthcare.
Well, Michael, I've been in Dallas for over 20 years now. Started my career practicing law. Started a couple of offices here in Dallas for out-of-town firms. Left the practice about 11 years ago. Been investing in a bunch of different things since then. I had a family member that was in this opioid treatment space, and about 4 years ago we launched on this mission that we call Pathway Healthcare to try to help people that are dealing with drug and alcohol addiction.
All right, now you're focused on evidence-based treatment. Open that up for me.
Well, it's interesting. The practice of medicine as it relates to addiction has been kind of all over the map for decades, and even still today in 2018, there is plenty of debate about the proper way to treat addiction. And with all the evidence and the studies that we see today, the proper treatment for at least opioids, which is what our country seems to be dealing a lot with now, is using some combination of medication and behavioral counseling. So that's what we've set out to do. Is we've tried to provide a platform, an office-based setting that allows people from all walks of life, whether they've got a job or a family, to be able to come in on a convenient basis to an office, just like you'd go to your doctor's office, and receive medical care and behavioral counseling. And that's something that even today I'm shocked when I talk to people around the country how really just people don't understand or even know the options out there for treatment, even with all the publicity you see in the press today about this problem.
I agree. What about the stigma that's attached to it? How do you deal with that?
Well, it's still a big problem. I get asked all the time about how do I think, we should be addressing this crisis in the United States today. And I think, one of the first things that we have to do is try to remove the stigma that's associated with this. People that suffer from the disease of addiction, they don't really want to talk about it. For years and decades, they've been shunned to, kind of outside of the medical community. And, one of the things that we're real passionate about is really bringing this into the forefront of just modern medicine. In 2016, actually, for the first time in several decades, the American Board of Medical Specialties recognized addiction as a subspecialty in the medical field. So, one of our big initiatives inside of Pathway Healthcare is to really just integrate into the hospital network, into the doctor network, so that we provide a holistic care. And I think that's a big part of removing the shame and stigma, is when people know that, much like you're treating other chronic diseases, whether it be diabetes or others, you have a brain chemistry issue, and it's not a moral failing. It's a problem that you need proper medical and behavioral care. So that's what we're trying to do.
Now, I know that the recovery process can last short periods to long periods. Give us an idea of what, when you're talking about behavioral changes or behavioral treatment and the medical treatment, what's going on. Give me a couple of for instances on this.
Everybody's obviously different, and we see people from all different backgrounds. And I would tell you just a good analogy is again looking at kind of the space of type 2 diabetes. If you take someone, Michael, that comes from a very stable background, that maybe has a good family support system, maybe even has a job, that might have had a surgery, that got addicted to opioids because they were taking prescription pain medication. That person obviously is someone that will respond, sometimes quickly to medication and behavioral counseling, and maybe even a short, 1-2 year period of time, and they can be back on the right path. But then you have some folks, that come from a history of addiction. Maybe their life's not put together in such a way. Maybe they don't have the support system. Maybe they continue to be in and amongst people that are exposing them to drugs. And that type of a person will take a lot longer, maybe a longer-term medication depending on the damage they've done to their brain, and, the deep behavioral issues. I mean, one of the things that we see, Michael, across all of our patients is more than 60% of our patients have some other co-occurring disease, mental illness, and it might be depression, anxiety, bipolar. So there's much more going on usually than just addiction.
So addiction can be actually a symptom to something that's really causing the problem.
That's exactly right.
Okay. How do you go about educating people about the treatment options for your evidence-based treatment?
Well, you try about everything you can. I'm actually right now in Atlanta at a conference, the prescription drug conference, and we spend a lot of time speaking, a lot of time just marketing our services. I've got two of the finest chief medical officers in the country, Dr. Brent Boyette and Dr. Stephen Taylor, and Dr. Taylor actually is the medical director also for the National Basketball Association. So both of those guys spend an enormous amount of time around the country speaking. But I also spend most of my days going to hospital systems. We operate across 5 different states: Florida, Texas, Mississippi, Alabama, Tennessee, and we're working with hospital systems in each of those areas, and sometimes partnering with the hospitals to try to educate the communities as well.
It seems to me that'd be a really good first step, because that's where they kind of end up when it really hits the bottom. Somebody picks them up, they're out, and then they drop them off there.
It's an enormous issue. The number of ER visits for overdose or drug-related problems has just been skyrocketing. There really are where the funnel is still at the ER level for those that are at their last option. So one of the things we're doing is we're launching programs in a number of different cities where we're working with hospitals and trying to get in and provide counseling to the doctors actually as they're caring for patients, and then trying to get that patient from the ER into our outpatient setting over time as well.
We got to go, Scott, but it's not your only interview here. It's just your first one. Thanks for being here.
Michael, thank you for your time today.
You're welcome. Scott Olson, CEO, pathwayhealthcare.com. If you know somebody that needs their help, you know where to find it, pathwayhealthcare.com. Thanks for listening. CEO Money. You can find us on our archives on our homepage, WFN1.com. We're all over the social media network, Facebook, Twitter, LinkedIn, you name it. And they're always on podcasts. Don't forget, we're moving to TV as quickly as we can get there. You'll see updates on our website, WFN1.com. Thanks for listening.